one person was holding the stretcher in position, and the other one was trying to hold the patient stable. So, things happen, we're all human, we make mistakes, so just try to get into the good habits of locking your stretcher and making sure your bed is, locked. Now, when you go into the rooms, it's gonna be a lot easier for you to move the bed, so that way you don't have to move quite so much equipment to move the stretcher, move the patient onto the stretcher. So those are all things that you're gonna be learning once you're into the clinical setting. When moving a patient from a cart onto a table, position the cart alongside the table on the patient's strong or less affected side. And when performing a lateral transfer, 2 sheets are needed, meaning you have a draw sheet and you have a sheet that's on the bed. So a draw sheet usually is positioned between their shoulders and their hip. It's a sheet that's been folded in half, and it gives you a little bit more stability with moving the patients. When you're moving make sure that there is not a space in between your stretcher and the x-ray tabletop. Move your tabletop. Now they all kind of swivel like this, and so you can bring it closer to the stretcher and make sure they're at the same level. Especially older people, because their bones are fragile and they're usually stiff and they're usually grabbing for air. Here is called the 2-sheet method. This is called what we call a draw sheet. Draw sheets are used 2 different ways. If the patient messes himself up or her up, then they can roll the patient, roll that underneath them, roll the patient this way, and get it out from underneath them if it's soiled. So that is considered a draw sheet. But we also use it to transfer patients. So here you can see this has come from, they rolled the patient up to the table. They have rolled the sheet so that way you have something to grab hold of. That's why false nails and long nails are not allowed in the hospital. Because if you have long nails, then you can't transfer patients, because you're gonna break your nails, because you're using everything in your strength in your hands to be able to move. Now notice that they have 2 people on one side. Usually if I'm moving the patient off of the stretcher and onto the x-ray table, we'll roll the sheet and get 2 people to pull the patient over, 1 person on the other side to make sure that the stretcher doesn't move. Because even though we lock the stretcher, sometimes the lock doesn't work. So we have to make sure about that. Yes.
So ideally, we want at least 2 or 3 people?
Ideally, yes. But you might work in a small hospital, working overnight, and you only have you. Okay, so ideally, we want as much help as we can get. And even though you're by yourself, you can go to the emergency room and ask for help, but a lot of times they don't show up. And for you to get going on your exam, you'll end up doing it yourself. But a lot of times you'll have a slide board, and we're gonna show you how that works also. Okay, this is a slide board. Here's the slide right here. So what happens is that you roll the patient towards you. Okay, you roll the patient towards you, and then you slide that as far underneath the patient as you can. And then you roll your patient onto the slide board, and it fits in between the spaces, so that way you can completely slide them from one bed to the other just from the slide board. I found out how to do this. Browse YouTube.
think the sound is off.
It's
don't know
up
what's
all
on.
the way.
You see to your right,
To my right,
mid right,
right here? Here?
little top, little.
Oh, yeah, yeah, in the
Where?
video, in the
Middle,
video
middle.
itself.
Oh, in the video itself?
The little square, the white one.
From
So little
That might not be
square.
on her screen.
Yeah, I
Wait,
don't see
Do you
it.
see that? Look at the
Towards,
projector.
towards the right side.
This is the play, this is my,
Miss Shepherd, look at the screen. You see that box over there?
oh, I don't see it on mine.
Oh, okay.
You have to click it with like
Do you have Bluetooth speakers?
Is it over here? Have they done something over here?
Yeah.
Hey, look, who's that?
Uh-huh,
Hi, there
uh-huh.
he is.
My
How do I
spinal
get
sense is going off
sound?
the computer.
How do I get
The
sound?
computer's muted.
Oh, the computer's muted. Oh, sorry, guys. Did you go upstairs?
I did, it's looking really nice.
I think the projector. Yeah.
You walked in just in
I
time.
did, I said something was amiss.
Okay, so here's the slide board. Because notice how there's a space between the stretcher and the bed? So you're sometimes the patient can drop down into that space, especially if the beds are not even
or long.
or locked. Okay? See how they just used it for that space? That's what you want. And hopefully, you can always find it in the department.
So how do you do it by yourself?
How you do it?
By yourself?
Well, you have to make sure that everything's locked. And what I do is I roll them up and then I push it in on this side and then I go down to this side and I push it in on this side. And a lot of times it will like go this way and that way and then you'll go to the middle and then you'll pull it towards you as much as you can. Okay? And then you'll roll your patient back, go to the other side of the bed and then pull the patient towards you. Okay? It's hard. That's like you always want to try to get help if you can. Because there's a lot of times where you're gonna be by yourself, you just have to make do with what you can. Okay? Preferably always try to get help. So when you roll your patients, you never roll them away from you. Why? They're gonna fall off on the other side of the bed. Especially if you have the geriatrics and they're kind of stiff. Once they start rolling, they don't stop. They can't stop. You know, they just can't. They just keep rolling. So you always roll the patient towards you. Here's a log roll.
Today I'm going to reveal two types of protein that make your arthritis pain worse. If you have
I love all these videos that you put in here.
Yeah. Good.
Transfer via a log roll. First bring up your knees and then cross your arms across your chest. Roll onto your side, keeping your spine nice and stiff. Put your feet off the edge of the bed and then push up through your hand and your elbow into the sitting position. Remember to stabilise before standing up, otherwise you'll get dizzy.
Now the beds have two different kinds of rails. They have
Yeah,
rails
yeah.
closest to the chest and they have
Cross
rails
with your arm
closer
and
to
control
the
with
feet.
your hand and elbow.
On this patient, if this was a patient, if he rolled, I would make sure that the one closest to the chest was up. That way they can hold it and stabilize.
With assistance, it's the same. First, assist the hands to cross and then the legs to lift up. With one hand on the pelvis and one on the shoulder. Turn onto the side without twisting the spine. Assist the legs off the bed and then
And
with
notice
one
how
hand
he does
on the
this
hip
all
and
in
on the
one
shoulder.
swoop.
Push up into the sitting
That's what
position.
you're gonna do.
Remembering to let the person
It's gonna be a
stay.
lot easier for you to help your patient than it is for the patient to
Down,
do it on their own.
again, it's the same. With one hand controlling the downward motion on the shoulder and on the pelvis before rolling the person onto their back, keeping the spine straight and assisting with the legs there.
And that's considered a log roll. But always make sure you have that upper bed rail up, okay? Not the bottom, because that's where you're gonna be standing, okay? And it's very difficult to hold the patient and put the side rail down at the same time. Trauma patients, we are a trauma center. We're a level 1 and we're a level 3. Okay, there's only 3 in Houston. Herman Memorial, Ben Taub are level 3s, or level 1s, and LBJ is a level 3. Okay, so you have a lot of trauma and they're gonna come to your department with what we call a C-collar on. They have, the only way that we can remove that C-collar is after they've had it cleared by radiography. Okay, so when we move these patients, always make sure that you have someone helping you, okay? Now, if you're by yourself and you have a C-collar on, okay? I'm going to stabilize the top part of the body as best that I can. I'm gonna probably put sandbags on either side of the head, and then I'm gonna use the slider. Okay? You're gonna develop the skills, your common sense skills, so you can do your work. Okay? But always try to stabilize the neck above everything. Okay? Before you move the patient, before you roll the patient, because they're gonna wanna help you, and you have to tell them, please don't help. Okay, let me do this for you, you know. Okay, these are some of the different kinds of positions that you can be in. Yes,
We don't put a pillow underneath the C-collar.
absolutely not. Okay, absolutely not. Okay, so y'all know the positions that y'all are in? Do you? All of them? RAO, LAO, RPO, LPO? Okay. Okay. Like even the one time that I told you that I went in because the beds were separating, I heard someone say help, and I ran in there. Okay, you're expected to do the same. If you hear the word help, you find out where it's coming from. It could be a patient, it could be another technologist needing, something, needing help, okay? Always answer, okay? Safety, I think Mr. Donahue loves this picture. He uses it a lot. And then we're finished with this. Any questions on what transferring patients?
I have a question, but it's totally not about transfer.
Okay.
I just want to know the difference between a level 1 and level 3 trauma center.
A level 1 and a level 3, level 1 receives the worst traumas. You have to have a license for those. You have to apply for them and they have to be approved. Your emergency room needs to be set up a certain way. You have to be able to hold whatever type of an emergency you have will determine if you go to a level 1 or a level 3. Okay? Now, say I'm in a car wreck, it's a fender bender, but my airbag went off. What level am I gonna go to? I'm gonna go to a 3. Okay, so I'm in a car wreck, my airbag goes off, but I have a broken, femur. A compound fracture of my femur. Y'all know what a compound fracture is?
Broken
That's where it breaks and the bone has punctured the skin. What level am I gonna go to? I'm gonna go to a level 1. So it's up to the status and the accreditation that our facilities have that will determine whether it's a 1 or a 3. Now, they're working on status right now to change LBJ into a level 1, because there's nothing on that side of Houston. You know, you've got Humble and you've got some facilities there, those are level 3s. And then, I think they should be if they're not, because they're pretty far out, Humble and Kingwood and stuff like that. And then you have to come all the way into the loop for, LBJ, and then you have to come all the way into the medical center for a level 3.
Okay.
Okay, so this is the running joke. Ben Taub gets all the gunshots and the stabs. And Herman gets all the MBAs, the car wrecks. That's the running joke. Why? Because they have a heliport, we don't. So if they come by ambulance, they can go to either one of us, because we're right beside each other. But if they have to be air flighted in, they're gonna go to Herman.
Level 3 is mind accidents, mind traumas, you said.
It's minor accidents.
Minor
Yeah.
accidents.
Well, they're not all minor, because a lot of times they'll send them to a level 3 to, like, say, I worked in Angleton. Well, Angleton, I mean, it's like 56 miles away from here. So they're gonna bring a trauma to me, I'm gonna work on them, they're gonna get it stabilized, then they're gonna air flight it out of there. Because my level 3 is not suited for the type of airplane crash that my crop duster had, okay? He's got massive fractures everywhere, every bone in his body just about is fractured. They're gonna bring him to the level 3, get him stabilized, so that way they can transfer him to a level 1. Okay? So let's go over 14. Okay, these are things that you are not gonna like very much, but they're things that we have to use in our imaging departments, okay? Because immobilization devices help us not to be exposed to the radiation that we possibly could be exposed to, okay? One of these is what do they call these now?
Biggest staff.
They're still called a pig-staff, okay? I mean, it's like a chair that we set the baby in like a high chair. And you bring the baby's arms up, and it has this plastic tube that we have to clamp around the baby for a chest x-ray. Okay?
Well, nowadays they prefer for techs and parents to hold
The parents to hold.
Like in Texas Children's, these are not even legally allowed anymore.
Yeah, yeah. Yeah, we were amazed when these came out. It was like, oh wow, these are great. But the thing is their little bellies can kind of pooch out. And when you close that up, it pinches their bellies. Yeah. This right here also slides back and forth. So that way, because this right here holds the x-ray plate. So I'm shooting from this is the side of the plate. This is where the x-ray enters the body. So I bring it out to put the baby in, but I slide the baby as close as I can to get to the plate. Why? what happens if my body, and it's common sense, y'all haven't learned it yet, it's common sense. If I'm further away from my plate, what's it gonna do to my image?
Magnify.
It's gonna magnify, okay? So I want as close to the plate as I possibly can, okay? Now, this also swivels. It swivels like this. It goes like this, and it swivels like this. So that way I can do my PA and my lateral before I have to move my patient. And believe me, you're moving fast. And the mothers in there, oh baby. Okay, then you have ambulatory. We call these walkie-talkies. We love those. But also with the walkie-talkies, you also have our frequent flyers. Does anybody know what a frequent flyer is? Yeah, you're gonna get used to seeing some of the same people. Artifacts. Artifacts are substances or structures that are present and they appear on the image. Now, when I was a student and when Mr. Donahue was a student, I don't know if did you have film?
We were one of the last classes to use film.
You were the last class to use film. That was one of our things that we had to do every day, is that we had to go to the dark room. Y'all don't even have dark rooms anymore. And we had to take out all of the films out of all of the cassettes and clean the cassettes to get all the lint and everything out because it would show up on the films. Okay? That's why we have women take off their bras, women take off their necklaces, nipple rings, we have to document. I'm not gonna watch someone take out a nipple ring, but I'll document that they have it in. Okay? But usually, instead of, they'll say, oh, I have a nipple ring in, and I'll put on my request that the patient had a nipple ring and it was not removed. Okay? Restraints. Now, restraints are not allowed. They're against the law. You have to kind of work around that. Okay? Like if I had a patient that needed to be restrained, I would take a sheet, I would leave it lengthwise, and I would tuck it in there just as tight as I could to make a papoose. That's a form of restraint, but it's not one I can get sued for. Yes.
This is why, I'm so sorry.
Go ahead.
This is why the child was inside that,
That's
thing
right.
is
They
not
call
being
that
allowed.
now a restraint. But they're still in service. People
Really?
still use them. They're still a tool for our imaging profession.
So I was just gonna say the legality of the child restraint, like Shaheen mentioned, is not necessarily in question because it's somewhat necessary. Like depending on the
As far as the
pathology.
child?
Yeah. So like, why is
Oh,
that
it was
legal?
it was just a normal practice. It was expected,
Okay.
okay? Because you're not supposed to hold your patients.
Right.
Okay? So if I'm not supposed to hold my patient and the mother's pregnant, I'm by myself, okay? I'm gonna use the Picostat. If I have one available, I'm gonna use it. Because I'm by myself, I'm working 11 to 7, I'm the only one in the department, and the mother's pregnant, no one else is with her, I'm gonna use a Picostat. You have to use your common sense.
Mom, do the babies always cry in the piggy
Always,
sets?
always,
And
always.
then, but that does not hinder the image because the
No, it's
baby-
better for us on our image, because what do? We take our image when they go, ah, ah. So when do we take our image? You know, that's when we take our image. You know, because they're gonna cry, they've gotta take in a breath. When they take in that breath, you better have the rotor going and ready to shoot that image. Okay? It's a normal practice, but they're, I've been in the field for a long time, so I saw it come in and I've seen it go out, so I don't know. Restraints. Okay, so if I have, you've got to use your common sense, okay? Now, I've even taken it where I've used tape to wrap around the patient's hands to kind of keep it where I need it. That's a form of restraint, but I could always say, but I needed it for my positioning. I taped it into my position. But as far as putting like those cuffs that they use, y'all have seen those, right? Where they put that, you have to have an order for that. You can't do it on your own. But you can use your linen to your abilities. But you can't use tape, and you can't use any type of rope or anything like that. Okay? So, what we do is that, now, okay, let me tell you a story. So, working in the graveyard shift, Ben Todd, they call me down for a pelvic exam. I go down to get the pelvic exam, and the lady was from, if you put two of these tables together, side by side, she was that wide. Okay? So she was in one of those special stretchers. Well, I couldn't fit it into my room. I had to do her in the waiting area. The waiting area, of course, it was graveyard shift, no one was there, but we had curtains that we could put out and I could lock the door. Well, if I'm gonna do a pelvic exam, what am I gonna do about this flap that women have? Okay, I didn't know what I was gonna do. I mean, I put my hand in there and I was like up to here under, in fact, I needed one of those veterinarian gloves. And then when I got it in there, it was so heavy, I couldn't even maneuver my transducer. Okay? So what I did is I took a sheet, I made it diagonal, I took one end and put the headrail up so I could have it, and I took it and I wrapped her fat pad underneath it. I had her pull it up as far as she could, and then I tied it to the other what is it? The headrail. That's a form of restraint, okay? But it was necessary for me to be able to get the exam. And you know what I found out on her? She was pregnant. That's why she was having it. Like, how did they even find it? I don't know. She was like huge.
So,
At least 500-600 pounds.
so how did they do an ultrasound, or did you just ask
Well, I
like,
had-
hey, when was your last cycle?
Oh, I had to ask all of that.
And
And she said, I haven't had a cycle in years.
so,
In years?
Years. Because anytime you have rapid weight loss or you're fat, you don't have periods all the time.
Then how did she get pregnant?
That's what I'm wondering.
oh,
Then she was certainly informing wrong, man. She has to have the cycle to.
No, you don't have to have a cycle. She could have had that cycle that just came out of the blue, and if it hit just right, she got pregnant. She hadn't had a cycle in years.
Come on, girl.
She did that. So you're gonna see all kinds, and I'm telling you these stories, so that way when you get into the clinical setting, you won't be surprised. Okay, so watch your technologists. How do they restrain their patients? How do they position those? Use their common sense to build on the knowledge that you have of your own common sense. Because you're gonna find something from me, like you might have someone that you're gonna have to use that maneuver to. I didn't know what to do. I was just thinking, how am I gonna get it underneath that pelvis, all that belly fat to do my exam? I couldn't think of any other. It's either that or cancel.
so sorry, one more question. So we also deal with psych ward patients, right?
Yes, we do.
So if
They
somebody's
always
restrained,
have someone with them.
if somebody's restrained in the classical straitjacket.
Straight jacket, they won't come to you, I think.
Okay, cool. That's like, I'd be a little scared.
Yeah.
I-
They'll be, some of them will be restrained, but they always have someone with them.
Okay, cool.
You were gonna ask a question?
Yeah, so being that you like restrained her, but because you needed to be able to do your job, would that still qualify as illegal?
That is still illegal. Okay? But I had a good reason for doing it. Me restraining her belly fat was necessary for me to do the exam. Okay?
So you
Yes.
found out she was pregnant after you did it, or how did, you know? 'cause
I
you keep
found out she
saying-
was pregnant. She didn't know she was pregnant.
Oh.
Did you
okay.
continue with the exam? Was-
Absolutely. Absolutely.
So.
Oh, this is ultrasound.
Oh, okay. I thought this was an
Oh.
X-ray. So,
X-ray.
here I was like,
Yeah,
we're just
like-
risking
See, I've
babies.
done X-ray and I've done ultrasound.
Okay.
Let's say you
Okay.
risked
So
it.
X-ray, you're gonna use tape, like if I have
Yeah, I
a
thought you
patient
were X-ray. That's
that
what I
is, won't keep its hand still, I'll put a sandbag on their hand. Okay, that's a form of restraint,
Yeah.
you know, and if I'm doing a wrist, I'm gonna use a restraint. You know, I'm gonna use an angle sponge with a sandbag on top of it. That's a form of restraint.
So
But it's
restraint,
necessary for me to be able to do my exam.
were restraints made illegal because the patient might injure themselves if they're like in a state where they can't really control their actions? Let's say they're like seizing or whatever, and you happen to have to restrain them to get the picture, and they jerk against it, they might break something.
I
Or
have no idea.
okay,
I don't know when and where, I don't know when it became illegal.
okay,
Okay?
just something to look into.
Yeah, it's just something that has progressed,
So now
as
what-
everything has progressed.
What I understand by you're saying is that restraint for the requirement to do your procedure
Yeah.
is okay.
Yeah.
As long
You cannot hold a patient down. Okay? Now, in my day and time, if you had a patient that was thin, then I would cover up with a gown and I would sit on the table straddling the patient.
Oh.
And having someone else hold the head to do like a facial series or something like that. So you had two technologies that were being exposed, but see now they don't even do that because they have CAT scans to do all that. So it's all progressed, yes.
So if she wanted to take you to court, like, if there, what do you,
She could've,
she could?
she could've.
And she would have had a case, like against you, like solid.
Yeah, she would've had a case.
Yeah.
Yeah, but I had a good case too.
Yeah. So like, would you you wouldn't have automatically lost, right? Like
No,
you would
no,
have said,
no.
okay, cool.
The hospital district would have fought for me.
Okay, cool.
Okay, because you're all insured. You know, you come into the program and you're insured, for liabilities. Okay? But use your common sense. That's all I can say is use your common sense. And if a patient is restrained, never unstrain them. Unrestrain them. Don't unhook them. Okay? Cause you're gonna go up to the floors and you're gonna see patients that are restrained. Okay? Huh?
Like an
Yeah, cause they keep them from taking out their tubes and stuff. Okay? Now, if I don't restrain my patients, then I have, the risk of having motion. Okay, and motion means I have to repeat, right? And if I have to repeat, and then I have to repeat again, and I have to repeat again, what am I gonna do?
exposing you to it.
I'm exposing the patient to unnecessary information. I'm gonna restrain that patient as best that I can. That is legal for me. Okay? And I'm gonna ask the patient, I'm gonna put this sheet around you to hold your shoulder steady. I know you're probably having spasms, but let's just go ahead and try this because I'm gonna have to repeat it because there's motion and I know you can't help you know, use your linen. You know, use your linen to help stabilize your patients, okay? Because you don't want to repeat any more than you have to. Because a lot of times when a patient's in pain, they come to you and they're in a tin, okay? They can't, tins cannot hold still. They've got to be moving. It's just like a woman that's pregnant. Okay, if she's in labor, she can't take a step. She can't walk. But if she's in Braxton Hicks, she can walk. Just like the pain level 10, they cannot hold still. They just can't do it.
Ma'am, do patients in labor are treated sometimes?
In labor, used to we did, I don't think they don't do it anymore. We used to do pelvimetries to make sure that the pelvis was large enough for the baby's head to come out. But they don't do that anymore. I've had a baby delivered on my table while I was running to the dark room to get my exam.
So the baby also got
Crazy.
exposed.
I've had a crazy career. Huh?
Then the baby got exposed to the X-rays.
Well, yeah, it was a third trimester, it was being born, so yeah, it was exposed to X-ray. But did I make sure that I measured the patient to make sure I wouldn't have to, that my little ruler was exactly where it needed to be? I triple checked myself, because I knew I was gonna be exposing, the fetus. Okay? So this is what an L spine looks like, and it has motion. It's real blurry.
What spine, ma'am, is it?
That's the L spine.
Lumbar
See
spine?
how my back is
lumbar.
going? Okay, so here's my S spine, here's my L spine. Okay. This is L4. Okay, this is L5. So I'm not seeing L5. There's a special view that you do that shows L5S1. Here's a hand. Had to repeat this hand. Okay, positioned exactly the same. How would I immobilize this patient? Is we have ankle swings. If my patient can't hold still, I'm gonna put it on an ankle swing. So that way I can position the fingers the way that I need. Huh? Yeah, that too. So, it can cause more than just motion blur. Oh, can y'all see the difference in this? What's
It's
the
not
difference?
in the middle.
Huh?
The image is in centered.
Yeah, it's
Magnification.
rotated. What else? Is the left bigger than the right?
Yes.
Yeah.
Okay, so I know I'm not there. Okay, what else can we see? It's made my heart look like it's bigger. Huh? Look how big that heart is.
Yeah.
So there's
Oh, this is that, why we do from the, like we told in the lab,
heart
that the heart should be towards the IR. Then if it's on the side of the,
No.
ray, then the heart comes
That's
out
why we
bigger.
do PA instead of
Yeah,
A.
yeah.
Yes,
So
like
it
the ray
almost-
should be.
it almost looks like a
from
lung.
posterior.
Yeah, that's what I was thinking too.
But the lungs are there, and that's the black spot.
What is this right here?
So, this,
Liver?
No, it's your
No.
liver.
I think it's the stomach.
The diaphragm?
Should be
Nope,
stomach.
my liver's gonna be over here.
It should be stomach.
The diaphragm?
Diaphragm.
My diaphragm.
Yes.
What is this little thing right here called? Y'all learned that yet? Costophrenic angle?
No.
Because when you do your chest x-ray, you've gotta make sure that you don't cut the costophrenic angle.
What is that?
Y'all know what area this is?
Clavicle.
Yeah, this is the
That's
clavicle,
the
but what part of the
clavicle.
chest is this?
Apex.
Apical.
Okay, look at the collarbones,
Mm-hmm.
okay? It looks like the collarbone is separated from the sternum.
Is this a child?
Mm-hmm.
Or a very small adult.
Oh.
Okay. So, immobilization principles. Communication with the patient is critical. You have to tell the patient what you're doing. You want to use the shortest exposure time possible because you want to get them done and you want to get them undone as much as you can. Okay? Just like the baby in the pick-a-stack. I'm gonna run to get I'm gonna have my technique set. I'm gonna go and position my patient. I'm gonna run and expose it and get it out. Okay? What type of patient would we use immobilization devices the most on? Trauma.
Old or elderly people,
Older, elderly, they're hard.
because they,
Children,
babies.
especially children. Okay? Anybody that can't hold the position that we need them to do, we're gonna use immobilizations. We're gonna use the devices that we have available to us in our departments.
So essentially, anyone who needs assistance.
Anybody that needs assistance. Anybody that needs assistance to keep us from having to hold it. Pediatric communication, never use threats or force and always apply restraints gently. Work with parents, employ their aid when necessary. If you have to use tape, let the mother know that you're gonna have to use tape. If you have to use tape, make sure that the tape, you're gonna turn it so the unstuck side is next to the skin. And then you're gonna twist it to the sticky side is where you're gonna use to restrain.
So you don't pull the hairs and
So you don't pull the hair or the skin off. Elderly especially, because they're thin, their skin is so thin. Okay? What else? I was gonna say something else, but now I can't remember. That fast, I forgot. These are positioning sponges. It helps reduce the patient, motion. It also helps, it comes in many shapes and sizes, and it helps us be able to position the patient. Okay? Here's all the different kinds of sponges that we have available to us.
Those sorts of sponges, like, would be for obliques if they're laying down.
Yeah, they're doing obliques. Now, I have one in the sonography lab. These are plastic. They're plastic covered. Make sure you clean them. If they're like the one that I have, it's just a sponge, put a sheet or something over it. Because if it gets bodily fluids on it, it can't be washed out, you have to throw it out,
The sponge?
the sponge.
Okay.
Because there's no way for us to sterilize it, to get the bodily fluids out.
but the body, ma'am, the bodily fluid will also pass through the sheet as well, right? They're not water.
Yes, it will, but at least it'll protect it a little
But-
bit, so maybe it won't be enough blood to get into my sponge.
My question to you is that even if it goes to the sheet and there's little on the thing, you don't
I
have
would
to.
throw it out.
Still then you have to throw it out.
Okay?
You can't wash it then, because you can.
I'm not gonna touch it. I wouldn't expect you to touch it. So this is another, instead of the pick-a-stats, you have these that are available now, and they're just sponges that you lay the baby in.
Yeah, these are quite cute and nice.
And you just lay your baby in them. Here is Velcro straps. A lot of our departments have Velcro straps that you can attach to your table. okay? That is also something that we can use. It is a strap, but it's Velcro. So that way you can hook it onto your table and you can take it off. And it's for patients that, like, say I had a patient on the table, I'm working the graveyard shift, and he's delirious, he's not really all there. How am I gonna restrain him? I'm gonna use these Velcro straps. Cause I'm gonna have to leave the room to check my films, right? I don't wanna move him back on the stretcher, put the side rails up, cause that's gonna take me an extra 30 minutes, and if I have to have a repeat, I've gotta move him back onto my table. It's just gonna be a lot easier for me to do a Velcro strap over the chest and over the top of the legs while I run and get my films. But I'm gonna stand at the door and I'm gonna be watching my patient until my film drops. Okay? I'm gonna be listening for my film to drop. Okay? I'm gonna run and get my film and I'm gonna go right back to my door. So I can still keep an eye on my patient. Because I'm there by myself, he's only Velcroed to the table, anything can happen. They have the immobilization devices, they have them all sizes. They can fit on your wrist, they can fit on your upper arms, they can fit on your legs. Here's this one for babies, for children, and it's just an immobilization device. It's like the slider board, see the slider board? And it has straps attached to it, like if I would use this strap to immobilize the head. Okay? This strap, I'm holding the baby's arms down by their side. This strap, I'm gonna hold the legs down. Because you're gonna have kickers and screamers, you're gonna have pinchers, you're gonna have biters, you're gonna have spitters. Okay?
And these devices
Use
are
what is available at your, in your department.
these devices are still considered restraints, so we
Correct.
shouldn't.
But it's
If necessary. we should.
necessary for me to get my image on. Okay, see how I said about the sandbag? I've positioned the patient, he can't hold his arm still. I'm gonna put a sandbag, so he can't lift his arm. Okay? I'm using an angle sponge, cause I'm doing a hand. I can also use an angle sponge for a wrist. Here, I'm doing an AP, remember this is AP, okay? If I did a PA, then my radius and ulna are going to be over each other. So I have to do a radius and a forearm like this. And to keep my hand down, to keep the patient from moving, I'm gonna use a sandbag on the hand. Yes.
Since they are not radio packed, will be on
Oh, yeah, you can't have that in the film. It's just sand. Okay? Yeah, you can't have it in the film.
So that would have the same like effect as shielding. It
Yeah.
should not be anywhere
But
near
you
the
can
eye.
still see through it. You can still, I mean, x-rays is gonna go through the sand,
Mhm.
but you're not gonna be able to look at the imaging and make a diagnostic image
Right.
with that artifact.
It's too obscure.
It's just to immobilize. And they're in every room. Sandbags are in every room. Because there's certain exams that we do that you have to have sandbags. Like the AC joints. Oh, there it is right here. Okay, so for me to look to see if there's separation up here, I have to have the patients, hold sandbags. Cause that way it brings down all of that and I'm able to see, are those joints even or are they uneven? Is one of them separated? If the patient cannot hold the sandbag, don't make them hold the sandbag. Patient unable to cooperate. Okay? That's definitely not allowed. Okay. Okay, here, like we talked about the tape, see how the unsticky tape is against the forehead and the sticky tape is attached to the table. Okay? Here the foot is, I'm trying to get a foot. And you can also use gauze to keep it there.
Gauze is not radio tape.
Yeah, it is not. You can see. Some gauze they use up in the OR, but it's cloth and it has a string in it. So that way, if it gets left in the body, then we can see it with X-ray. But gauze, normally, we can X-ray through it. Okay? Notice that it's got sandbags here on at the knee, so the patient can't bend their knee up. Tools of the trade, always keep tape in your pocket. Okay? Because there's nothing more irritating than there's no tape in your room. And if you've got a baby, you've got to carry the baby or have the mother hold the baby while you go and find tape. Okay, tape comes in multiple forms. In my locker, I always kept 2-inch tape. Because this little 1-inch tape sometimes isn't enough. Or if I saw it, if I was up on the floor, I would steal it from another section. So I could make sure I had 2-inch tape. It comes in cloth. It comes in like almost like a stretchy thing. It comes in just like regular tape. This tape here is real easy to tear, especially for like your markers and things like that. It's easy. If you're having to use like one hand almost because you're holding the patient with your elbow and you're trying to tear, because some of this tape, like the cloth tape, you have to have scissors to tear it.
This was the waxed one, right, ma'am?
I'm sorry?
The waxed tapes that you get, the waxed. They just, how do you recognize this tape first?
Top one.
Top left is the one you said, the paper.
This is the easiest one.
What is it? It is this
Yeah,
the paper.
this is the hardest one. The paper, the cloth tape is the hardest.
So
Because
the
you can't tear it, you have to cut it.
so the top left one is like the one that has plastic looking grids on it.
Yeah, it has like little grids on it. Okay? Now, and then you have paper tape, and then you have cloth tape, and then you have waterproof tape. You know, so you have all kinds of tape that you're gonna have choices with. Me, whenever I was a technologist, I bought my own tape. I was real particular about the tape that went on my markers. And I'm glad I did, because they stopped making it. And I had a surplus. So, special applications, most common spinal trauma traction device you'll encounter is the cervical collar. Everybody that comes from a car wreck or whatever will come with you with a C-collar. We never remove that. That to be removed, that has to be approved from the emergency area. After the radiologist has cleared it, you do not remove it. You wait for the emergency room to come down and remove it. Okay? Nowadays, you have radiolucent backboards. So I can do the exams that I need through my backboard.
Without ever having to lift
Without
it.
ever having to move the patient off. When I was a technologist, we only had wood. And we couldn't x-ray through wood, we had to take them off.
Did that put the patient at risk?
I would always get my C-collar done first. And, because I could do my C-collar, portable light, and then I could use my Bucky to get my lateral. And then I would go and get that cleared before I would ever do anything else. But now they have boards that you can x-ray. They also have holders that will help you with your lateral C-spine. Okay? It slips underneath. It has like a little lip on it. It's shaped like an L, like this. It's shaped like an L. Okay? This slides underneath the patient or the backboard, and this part holds your film, so you can get your imaging.
Ma'am, this collar is all, I heard there was another present-day collar you use for the neck if it's injured. That's not true.
This is the collar that you're gonna be exposed to in the hospital. We're
This
talking
is-
about just the.
Just for the neck.
They'll never come to you with that,
If,
unless
but-
they've already had surgery.
Ma'am, this is saying spinal trauma, and then she's wearing the collar.
Everybody comes to you with a C-collar on.
That's what every
Every-
accident has been.
Every accident.
Because they have not yet
Yeah.
investigated.
Just
Oh, I
about.
see, this is.
Unless I fell out of a tree and broke my leg or whatever. Everybody's gonna come to you with a C-collar. I would say 95% of your patients are gonna have a C-collar.
Accident.
Anytime you're in an accident and an ambulance picks you up, you're in a C-collar.
Because they don't know what injuries
Yeah,
you
that's
They don't know what else you've got. Okay? These are called halos. And they are wicked. It's an immobilization device that they can use if I have multiple fractures. You'll see them in the head where they actually screw it into the skull, and you'll see it into the legs. It looks like this person here. When you lift this leg, you have to let your patient lift it as much as they can. Okay? Try to get help. So that way you can immobilize it as best that you can while you're trying to move it. Use your common sense. Leave the leg like it is and just get your imaging the best that you can. Never grab hold of it and pull it up.
This is to protect the injuries that the patient has.
The patient has had surgery. You only see these after surgery.
Halos,
Yeah.
obviously not.
Yeah, you'll only see those after surgery. Like, you'll have a halo if I want to be taller and I'm having my femur extended. You'll see a halo. People will do all kinds of stuff. Okay? Normally, you're gonna see it with a really, really bad fracture. Splints are radiolucent also, where you can examine your patient with the splint on. Okay? You've also got these kind of splints. I would ask the patient if it's removable. If it's removable, I would have them remove it. Like if they say, I said, you'll say things like, oh, that must be uncomfortable to have to wear a splint like that. It must be hard to bathe. Oh, I can take it off the bathe. Well, they can take it off for about the same. Okay? Because you can find out answers without having to be direct. You can build that rapport to them, like, oh, that looks uncomfortable. You know, It must be really hard to bathe with that,
So it's like to see, to show that you're empathetic to their.
to show that I'm empathetic. That's how I connect to my patients, you know? I'm not gonna say, oh my God, what happened to your arm that you have to wear that thing? That looks horrible. I would never say something like that.
Ma'am,
I'm gonna be empathetic towards them.
ma'am, the splints can be radiolucent, but these straps can,
Some you can undo the straps sometimes.
these straps can probably.
Like on the splints, sometimes these little Velcro things show up too. Open them up, so that way it won't be in your film, because they will show up on your x-ray. Here are other splints. And I can honestly say, I don't know if they're radiolucent or not, I think that they are. Okay, because if this was all taped in, I wouldn't undo the tape. Okay? I wouldn't undo the tape. But how am I gonna do that if I do my PA hand? How am I gonna get my lateral? Am I gonna go like this, or am I gonna go like this?
You said a PA hand?
Okay, so here's my plate. Here's my plate. I can get my PA finger just right, correct? I can do my PA, but it's this finger. Am I gonna move my finger like this, or am I gonna move my finger like this? Correct. Why? Magnification.
Ma'am, if it's closer, it's less magnified.
Correct.
It's less magnified.
Okay, now, on this right here, I'm gonna ask the mother, do you take this off to bathe the baby? Are we able to take this off? Okay, I'm gonna ask permission. Anti-shock garments used to slow rate of internal hemorrhage, they're also going to be radiolucent. So when they come to you and they have these devices to stop the bleeding, then don't remove those. Children as young as 3 and 4 can be convinced to cooperate for the exam, as long as you connect with them. Okay? Oh, God, that's so funny. Okay. So when you talk to a pediatric patient, you're gonna get down to their level. If they're sitting in their mother's lap, I'm gonna pull up a chair and I'm gonna talk to them. Okay? I'm not gonna do baby talk to a 12-year-old. Okay? I'm gonna try my hardest not to react to what I'm seeing. Sometimes it's hard, but you have to be very, very careful. If you feel like you're gonna get sick, just say, I'm gonna go and get me some tape, and I'll be right back. They don't know what you're doing. Okay? Ask your patients to help you as much as they can. Okay? Don't tell them that you're taking x-rays. Tell them that you're just taking pictures. Remember, we used that from Mr. Donahue. Okay, when he didn't want to take off his Spider-Man shirt. Infant restraints. You can use these with the sheets that you have in the department. Towels. A lot of the towels aren't going to be long enough for this, but you can use your sheets. It's just like swaddling a newborn. It's called a mummy wrap.
Is there
It
another,
keeps the arms out of the way.
is there another step after E? Like you would fold that little tail up between their legs or not?
What if I'm doing the legs though?
Are you doing both of them at the same time or?
No. Then how am I gonna restrain the other one? I don't know. I'd have to use my common sense. This is just used when you need to move the arms out of the way.
I see.
Like the baby's flailing. It wants to pinch you. It helps immobilize the head, because if they can't do this very much, then they're not gonna be able to do this very much. But just make it trying. A lot of times if I had a baby at the house, I would fold this part in and swaddle it that way. But at work, I'm not gonna do that. I'm gonna get the baby in as much as I can. Okay? You can see that this is a PA chest, and this is a left lateral chest. It's called a pigostat, and it goes this way and it goes this way. You can move it both ways. Velcro straps are used to do it, and sometimes they'll have like a little hook. Here you can restrain your baby, and you can actually take the board and move it, pick it up and move it the way that you need. So use your communication whenever you're talking to them, and get them to try to cooperate with you as much as possible. Your geriatric patients, their greatest fear is falling. Okay? You want to stabilize them with, offer them a wheelchair, transferring them to the bed that you need to, holding them where they feel comfortable. Either hold them at the elbow or the humerus up underneath the arms, or have them hold on to you. Okay? Tape on a geriatric patient is critical because it tears their skin. If I have this stretcher, and if I have a radiolucent pad, and I know the patient's gonna be there for a while, I'm gonna use my pad. I'm gonna use my pad, I'm gonna cover it with a sheet, and I'm gonna cover them up with a sheet. I can use an angle sponge to put underneath their knees to kind of take some pressure off of the back. So use your imagination, use your common sense. Be sure to pay attention to your technologist when you're working with them, so you can pick up some good tricks on how you're going to be able to get your imaging. Okay? So, how can I help you review? I don't have a book with me. Ask me questions.
Do you have to know what each does?
Yes. We need to know what type of immobilization, the different types that there are. Okay, especially like the pigostat, those boards that we use, we call those papoose boards. Tape. So you need to know what immobilization devices are available.
Are you gonna have, like scenario questions?
I don't remember.
With the do you have given us a PowerPoint for these chapters? I haven't seen it. It's on
Yes. Do you have the PowerPoints?
Yes. And then the PowerPoints and the book, you need to.
Yeah, you need to read your book, because this is just what we took out of the book to help you understand what you're reading.
So if you read the chapters, you're good.
You read the chapter, look at the pictures that are there. Don't just read the words, you need to look at the pictures, because that's gonna help you remember.
Do you know about how many questions you have? Does it say
I think there's 50. You already have it, so be sure you download it before, you come in tomorrow. Okay? Oh.
Do we have to know the different, all the types of transfers?
Absolutely. Whenever I transfer a patient to or from in a wheelchair, am I gonna do the foot pedals, or am I gonna make the patient do the foot pedals?
I'm the
I'm gonna
technician,
do-
I'll do it.
I'm gonna do that. Am I gonna use my hands, or am I gonna use my feet?
Hands, yes.
I'm gonna use my
Big gloves.
with gloves. Because I need to get down there to see, is the patient's leg far enough back that whenever I bring up that foot pedal, that I don't hit the patient? Okay? If your patient tries to get out of the wheelchair before you're ready, say, no, I need you to stay right there for just one more minute. I'm getting the room ready. You know, you have to tell the patients what you want them to do. Okay? Not what they want to do, but what you want them to do. Like the hairy chest. You take off your shoes. But I'm having my foot x-rays. I know. I don't have to give an excuse. But I'm having my foot x-rayed. I know. I do love a hairy chest. I have no idea. I have no idea. I guess growing up on the beach, I always liked the surfers with a hairy chest more than the ones that didn't have any hair. So I guess I like the older surfers. Okay, so y'all go to lunch?